Have you ever noticed how hearing the word diagnosis can make your body tense before you even know what it means? One of my patients once shared that the moment she heard a doctor mention testing, her mind jumped straight to worry and sleepless nights. I want you to imagine this instead. You are sitting comfortably, listening to a doctor who is not rushing you, not alarming you, but walking you through things one calm step at a time. Hello, I am Dr. Evelyn Carter. I am a 60-year-old physician here in the United States, and I want to welcome you warmly to Senior Health Daily. This is a place created for older adults who deserve clarity, patience, and respect when it comes to health. Today, we are talking about Nipah virus and, more importantly, how doctors really diagnose it. Let me say this clearly from the beginning. Diagnosis is not a dramatic moment. It is not a single test or a sudden decision. In everyday medical practice, diagnosis means listening carefully, observing gently, and understanding the whole person sitting in front of us. Before any test is ordered, doctors begin with your story, how you are feeling, what has changed, what your body has been telling you quietly over time. In my years of caring for older adults, I have seen how anxiety can interfere with memory, sleep, and even understanding simple explanations. When people feel rushed or frightened, the brain struggles to take in information. But when explanations are calm and clear, the mind steadies. The aging brain is very capable when it feels safe. That is why this conversation matters. Headlines often make diagnosis sound urgent or frightening, but the real process is thoughtful and careful. It is designed to protect you, not overwhelm you. Today, we will explore how doctors truly diagnose Nipah virus and why that process is far more reassuring than it may sound at first. If you find this kind of gentle guidance helpful, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support helps us continue creating calm, trustworthy health content made especially for you. In the next part, we will take a closer look at what diagnosis really means and how doctors approach it with patience and care, always keeping your well-being at the center. When doctors talk about diagnosis, we are not talking about a single moment or a quick decision. Diagnosis is a process that begins quietly, often before any test is mentioned. In my years of practice, especially with older adults, I have learned that good diagnosis starts with calm observation. It starts with noticing, listening, and allowing the body's story to unfold without pressure. When a patient sits across from me, the first thing I pay attention to is not a chart or a screen. I notice how they walk into the room, how they settle into the chair, how they speak. These small details matter. They tell us how the body is functioning in real life, not just on paper. For seniors, these observations are especially important because the body often communicates in subtle ways as it ages. Calm observation allows doctors to see patterns rather than isolated signs. A symptom by itself can be misleading. Fatigue, for example, can come from many causes. Stress, sleep changes, medication effects, or simple aging can all play a role. When we observe calmly over time, we begin to understand what belongs together and what does not. This approach protects patients from unnecessary worry and unnecessary testing. I often explain to older adults that diagnosis is like putting together a picture slowly. We do not rush to fill in the blanks. We let the image become clear on its own. This is especially important for emotional safety. When patients feel watched carefully rather than judged quickly, their bodies relax. When the nervous system relaxes, communication improves. People remember details more clearly. They feel safe enough to share what they might otherwise hold back. From a scientific standpoint, calm observation reduces error. Stress can distort perception, both for the patient and the clinician. A steady pace allows the brain to stay in a problem-solving state rather than a reactive one. This leads to better judgment and better outcomes. For seniors, this approach has added benefits. The aging brain responds better when it is not overwhelmed. When information is delivered slowly and observations are gathered patiently, understanding improves. Memory feels steadier. Confidence grows. The body cooperates rather than resists. When it comes to diagnosing Nipah virus, this same principle applies. Doctors do not begin with fear or assumptions. They begin with careful observation, grounded in experience and guided by context. This quiet beginning is intentional. It allows the diagnostic process to unfold thoughtfully and respectfully. By starting here with calm observation, we lay a strong foundation. It reminds us that diagnosis is not something done to a patient. It is something done with them, in partnership with patients and care. Once calm observation has begun, the heart of diagnosis unfolds through patient history and gentle questioning. This is where medicine becomes deeply human. In my experience, especially with older adults, the most important information often comes not from machines, but from listening carefully to a person's story. Patient history is not an interrogation. It is a conversation built on trust. I ask questions slowly and with intention, allowing time for memories to surface. How has your body felt lately? What feels different from your usual rhythm? When did you first notice a change? These questions may seem simple, but they help create a timeline that guides medical judgment with clarity. For seniors, history matters even more because symptoms can blend with normal aging. Changes in sleep, appetite, balance, or mood may have many explanations. When doctors understand a person's daily routine, long-term conditions, medications, and recent experiences, patterns begin to emerge. Those patterns are far more reliable than any single symptom. Gentle questioning also supports emotional safety. When people feel rushed, they may shorten answers or second-guess themselves. When they feel heard, they share more openly. I have seen older adults remember important details only after a pause, when they realize there is no hurry. That pause is not wasted time. It is essential time. From a clinical perspective, patient history helps doctors decide what is likely and what is not. In the case of Nipah virus, history plays a crucial role. Travel, exposure, and context matter. Without these details, testing would be blind and unnecessary. With them, decisions become focused and thoughtful. This protects patients from stress and from procedures they do not need. There is also a cognitive benefit to this approach. When seniors are invited into a calm conversation, the brain engages in recall rather than defense. This supports memory and comprehension. It also builds confidence. Patients feel involved rather than acted upon. I often reassure my patients that their voice is a vital diagnostic tool. Their experiences guide us more than they realize. Medicine is not about catching people off guard. It is about walking alongside them, gathering information with care. This process honors dignity. It respects the wisdom that comes with age. It reminds us that diagnosis is not something hidden behind closed doors. It is shaped through dialogue, patience, and mutual respect. By grounding medical judgment in patient history and gentle questioning, doctors create a clear path forward. This approach reduces fear, sharpens understanding, and allows the diagnostic process to remain steady and reassuring. It prepares us to move deeper into evaluation with confidence, knowing that the foundation has been laid with care. One of the most important things I share with older adults is that symptoms alone are never enough to tell the full story. A symptom is a signal, not a conclusion. In medicine, especially when caring for seniors, we learn to pause before assuming what a symptom means. That pause protects patients from fear and protects doctors from error. As we age, the body speaks more quietly and sometimes more broadly. Fatigue can come from poor sleep, medication side effects, emotional stress, or simply changes in routine. A headache might reflect dehydration, vision strain, or tension held in the body. Even fever can have many explanations. If doctors reacted to every symptom as a final answer, patients would be exposed to unnecessary worry and unnecessary testing. In my clinical work, I have seen how assumptions can cause harm. When a symptom is taken out of context, it can lead to rushed conclusions. Those conclusions can miss the real cause or create anxiety where none is needed. That is why doctors are trained to slow down and ask what else could explain what we are seeing. This habit of questioning our first impression is one of the quiet strengths of good medical care. For seniors, avoiding assumptions is especially important. Aging bodies respond differently than younger ones. Symptoms may appear softer later, or in unusual combinations. Memory changes, chronic conditions, and long-term medications can all influence how symptoms show up. When doctors understand this, they become careful interpreters rather than quick judges. There is also an emotional reason for this approach. When people hear that a symptom might mean something serious without careful explanation, fear can take over. Fear affects sleep, appetite, and clarity of thought. I have watched patients become more unwell from anxiety than from the symptom that brought them in. By avoiding assumptions, we protect emotional balance as well as physical health. In the case of diagnosing Nipah virus, this principle is critical. Many early symptoms can resemble common illnesses that seniors experience from time to time. Without context, jumping to conclusions would be irresponsible. Doctors look at the whole picture. They consider history, environment, and likelihood. Only when symptoms align with a broader pattern do we move forward thoughtfully. This approach reflects respect. It tells patients that they are more than a checklist of symptoms. It reassures them that medicine is not a guessing game. It is a process built on patience, pattern recognition, and care. By treating symptoms as part of a larger story rather than a final answer, doctors create space for accuracy and calm. This steady approach allows seniors to feel safe, understood, and confident that their care is guided by wisdom rather than urgency. When people hear the word testing, many imagine an automatic next step that happens quickly and without much thought. In real medical practice, especially with older adults, tests are chosen carefully and only when they truly add clarity. This careful selection is not about delaying care. It is about protecting the body and the mind from unnecessary strain. In my years of caring for seniors, I have learned that every test carries a cost beyond the procedure itself. There is the physical effort of getting to an appointment, the emotional weight of waiting for results, and the stress that uncertainty can bring. Because of this, doctors do not order tests simply because they are available. We ask a quiet question first. Will this test meaningfully change how we care for this person? Medical judgment guides this decision. After listening to history and observing patterns, doctors consider likelihood. If something is unlikely based on context, testing may do more harm than good by creating worry. If something is possible and the result would guide treatment, then testing becomes a helpful tool. This balance is especially important for seniors, whose bodies may respond more strongly to stress. From a scientific perspective, tests are meant to confirm or rule out a specific possibility, not to search blindly. Good medicine narrows the question before choosing the tool. When diagnosing a condition like Nipah virus, doctors look first at exposure history and overall presentation. Without those factors, testing would not be appropriate. With them, testing becomes focused and purposeful. I often explain to my patients that restraint is part of good care. More testing does not always mean better care. Sometimes it means more confusion. False positives can occur, especially when testing is done without strong reason. A result that looks concerning but does not fit the clinical picture can lead to anxiety and additional procedures that were never needed in the first place. For older adults, this thoughtful approach supports emotional safety. When tests are ordered with clear explanation and clear purpose, the mind stays calmer. Patients feel included rather than surprised. They understand why a test is being done and what it can and cannot tell us. There is also dignity in knowing that your body is not being treated like a problem to be solved quickly. It is being respected as a whole system that deserves care and patience. Medical tests are tools, not answers by themselves. They work best when guided by experience and context. By choosing tests carefully and only when necessary, doctors protect both physical well-being and peace of mind. This approach keeps the diagnostic process steady and humane. It reassures seniors that every step is taken with intention, respect, and their best interests at heart. When laboratory testing becomes part of the diagnostic process, I want seniors to understand that it is meant to bring clarity, not confusion. In my practice, I often see worry rise simply because the word laboratory sounds complicated. The truth is that these tests are tools designed to answer very specific questions, and they work quietly in the background to support careful medical judgment. Laboratory testing does not begin with complicated machines or unfamiliar procedures. It usually starts with simple samples, such as blood or other fluids, collected gently and respectfully. These samples are then examined to look for signs that help doctors understand what the body is responding to. The goal is not to overwhelm the patient with numbers or terms, but to confirm what we already suspect based on observation and history. I often explain to older adults that laboratory tests are like a second pair of eyes. They do not replace listening or clinical experience. They support it. A test does not speak on its own. It needs to be interpreted within the context of the whole person. This is especially important for seniors, because normal aging can influence test results in subtle ways. What looks unusual on paper may be completely appropriate for a particular individual. From a scientific standpoint, laboratory tests are designed to be specific. They look for markers that indicate whether a certain process is happening in the body. In the case of diagnosing something like Nipah virus, tests are only considered when there is a meaningful reason to look. Without the right context, testing would not be helpful and could create unnecessary concern. For emotional safety, clarity matters. When doctors explain what a test is for and what it can tell us, the mind stays calmer. I have seen how patients relax when they understand that a test is not a verdict, but a piece of information. It does not define them. It simply helps guide the next thoughtful step. Waiting for results can be the hardest part. That waiting often brings worry if it is not supported by reassurance. In my care, I remind seniors that most tests are done to rule things out, not to confirm something frightening. Silence during waiting does not mean danger. It means the process is unfolding carefully. Laboratory testing works best when it is explained in plain language and placed in context. When seniors understand that these tests are part of a larger, respectful process, fear softens. The body responds better. Sleep improves. Trust grows. By keeping laboratory testing simple and grounded, doctors protect both understanding and dignity. Tests become allies rather than sources of stress. This calm approach allows the diagnostic journey to remain steady, supportive, and centered on the person rather than the procedure. Before we continue, I want to pause with you for a moment. In my exam room, there is always a point where information needs time to settle. Not more facts, just a breath. Older adults often tell me that this pause is where understanding actually begins. When the body feels unhurried, the mind stays open. Everything we have talked about so far has one purpose: to help you feel steady while learning. Diagnosis is not meant to rush you forward. It is meant to support you where you are. When explanations are gentle and paced, the nervous system relaxes. That calm state allows memory to work better, questions to surface, and confidence to return. In caregiving, I have seen how powerful reassurance can be. When seniors feel respected, they participate more fully in their care. They remember details more clearly. They feel less alone. This is why tone matters as much as information. A calm voice can do as much healing as a test result. If this conversation has helped you feel more at ease, that tells me something important. It means your body is receiving information in a healthy way. That is exactly what we hope for here. Learning should feel supportive, not heavy. It should leave you feeling capable, not concerned. I want to share something with you directly, just as I would with a patient who has trusted me enough to listen closely. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. Your engagement helps this space remain available for others who may be quietly searching for reassurance. Many seniors watch without commenting. Many caregivers listen late at night, hoping for clarity. When you support this channel, you help extend that calm to people who truly need it. As we continue, remember that nothing you hear here requires immediate action. There is no urgency placed on you. Your routines remain safe. Your daily life remains steady. This information is here to build understanding, not to interrupt peace. Taking a moment to pause is not a delay. It is part of good care. When we move forward gently, the body cooperates. The mind stays present. And learning becomes something you can carry with you comfortably. Thank you for allowing this pause. It is a sign of respect for yourself and for the process of understanding. When people hear the phrase early diagnosis, it is often misunderstood as a warning or a signal to worry. I want to gently reframe that idea, especially for seniors. Early diagnosis is not about fear. It is about preparation. It is about giving the body and the mind enough time to respond thoughtfully rather than react emotionally. In my years of caring for older adults, I have seen how preparation brings comfort. When something is understood early, there is space to plan calmly. Doctors can monitor changes, adjust routines if needed, and offer guidance without urgency. This steady approach is far kinder to the aging body than waiting until symptoms feel overwhelming. For seniors, preparation supports dignity. It allows people to remain involved in decisions about their own care. When information arrives early and gently, older adults can ask questions, reflect, and feel confident about what comes next. There is no rush to change daily life. There is simply awareness, which is a powerful form of reassurance. From a medical perspective, early diagnosis helps doctors rule out possibilities just as much as it helps identify them. Often, the most valuable outcome is confirmation that something serious is not happening. That clarity can lift a quiet weight many seniors carry when symptoms feel unexplained. Relief is a form of healing that is often overlooked. There is also an important emotional benefit. Fear tends to grow in uncertainty. Preparation reduces uncertainty. When people know what is being watched and why, the nervous system settles. Sleep improves. Appetite steadies. The mind stops filling in gaps with worst-case scenarios. I often tell my patients that early diagnosis gives us time, and time is one of the greatest supports in later life. Time allows the body to adjust gradually. It allows caregivers to remain calm. It allows routines to stay intact. Nothing needs to change suddenly. In the context of diagnosing something like Nipah virus, early evaluation does not mean expecting illness. It means confirming safety. For seniors living in the United States, this knowledge is meant to protect peace, not disturb it. Doctors approach early diagnosis with restraint and care, always guided by likelihood and context. Preparation is quiet. It does not announce itself loudly. It works in the background, offering stability and confidence. When seniors understand early diagnosis in this way, fear softens, trust grows, and healthcare becomes something that supports life rather than interrupts it. When medical evaluations involve older adults, and especially those experiencing memory changes, the approach must be slower, kinder, and more attentive to emotional safety. I have learned that how an evaluation is conducted often matters as much as what is being evaluated. The goal is not just accuracy, but comfort, dignity, and trust. Memory changes can affect how information is received and recalled. A busy clinic, unfamiliar faces, or rapid questioning can create confusion even for someone who manages well at home. When that happens, the body may respond with anxiety, which makes memory feel even less reliable. This is why thoughtful pacing is essential. Giving time for answers to emerge allows the brain to settle and participate. In my practice, I pay close attention to the environment. A calm room, a steady voice, and simple language help the nervous system feel safe. When people feel safe, they communicate more clearly. They remember more than they expect to. Even small adjustments, like asking one question at a time or allowing pauses, can make a meaningful difference. Caregivers play an important role here. They offer context and continuity, but it is equally important that the older adult remains at the center of the conversation. Speaking to the person first, making eye contact, and acknowledging their experiences preserves dignity. When seniors feel respected, cooperation improves and evaluations become more accurate. There is also a need to consider fatigue. Medical visits can be tiring, especially for those with memory changes. Long appointments or too many instructions at once can overwhelm the mind. Breaking information into smaller pieces and repeating key points gently supports understanding. Written summaries can help, but they should be clear and simple. From a clinical perspective, memory changes do not mean a person cannot participate meaningfully in their care. They mean the approach must adapt. Doctors learn to listen for consistency rather than perfection. We look for patterns across time rather than relying on a single moment of recall. This reduces pressure and allows the evaluation to reflect reality more closely. Emotional safety remains central. When older adults feel rushed or corrected, confidence can fade quickly. When they feel supported, they often surprise themselves with how much they can share. I have seen patients with memory concerns offer valuable insights when given space and patience. In evaluations related to diagnosis, including discussions around conditions like Nipah virus, these considerations are essential. The aim is reassurance, not strain. By honoring routine, allowing familiarity, and respecting pace, medical evaluations can remain gentle and effective. This approach protects more than memory. It protects identity. It reminds seniors that they are seen, heard, and valued. When care adapts to the person, trust grows, and the path forward feels steadier for everyone involved. There is a quiet science behind calm communication, and it matters deeply for older adults. When the brain feels safe, it processes information more clearly. This is not philosophy, it is biology. In later life, the nervous system becomes more sensitive to tone, pace, and emotional cues. When communication is calm, the body remains regulated. When communication feels urgent or tense, the body shifts into protection mode, and understanding becomes harder. In simple terms, the brain has limited space for new information when it is under stress. Stress hormones narrow attention and reduce memory formation. This is why rushed explanations often leave seniors feeling confused or uncertain, even when the information itself is accurate. Calm communication does the opposite. It keeps the thinking centers of the brain engaged and allows details to settle. I see this every day in clinical practice. When I slow my voice, allow pauses, and check in gently, patients ask better questions. They remember instructions more accurately. They are more willing to participate. Cooperation improves not because people are trying harder, but because their bodies are no longer bracing. There is also a trust effect. Calm communication signals respect. It tells the listener that they are not being judged or hurried. For seniors, this respect restores confidence. Confidence supports cooperation. When people feel confident, they share more honestly and follow guidance more comfortably. From a caregiving perspective, calm communication reduces resistance. I have worked with many older adults who initially seemed uncooperative. When the tone changed, so did their response. What looked like resistance was often fear or confusion. Once that fear softened, cooperation followed naturally. Simple science explains this. The brain learns best in a regulated state. Calm voices help regulate breathing. Regulated breathing supports focus. Focus supports understanding. Understanding supports cooperation. Each step builds on the one before it. This matters greatly during medical evaluations and discussions about diagnosis. When doctors explain processes slowly and without pressure, seniors are more likely to engage fully. They are more likely to remember what was said and to feel comfortable asking for clarification. This improves outcomes and reduces unnecessary worry. Caregivers benefit from this approach as well. When communication is calm, caregivers feel less burdened. They become partners rather than messengers. The entire care environment becomes steadier. In conversations about diagnosing conditions such as Nipah virus, calm communication ensures that information informs rather than alarms. It allows seniors to stay grounded in their routines and confident in their care. Understanding does not come from volume or speed, it comes from steadiness. Calm communication honors the aging brain and supports cooperation in a way that is both scientific and humane. When the body feels safe, learning becomes possible. And when learning feels possible, care becomes collaborative rather than stressful. As we arrive at this final part of the deeper explanation, I want to gently gather everything we have explored and let it settle into a sense of trust. Not a conclusion that presses for action, but a quiet understanding that can rest comfortably with you. In my years of caring for older adults, I have learned that reassurance is most powerful when it feels earned through clarity and patience. What we have seen is that medical diagnosis is not a dramatic event. It is a thoughtful process guided by observation, listening, and careful judgment. Doctors are trained to move slowly for a reason. Each step is designed to reduce uncertainty, not create it. When care unfolds this way, the medical system becomes something you can lean on rather than worry about. Trust grows when you understand how decisions are made. Calm observation opens the door. Patient history provides direction. Symptoms are weighed with context. Tests are chosen with intention. Communication remains steady. Each element works together, quietly and consistently. This is how medicine protects both the body and the mind, especially in later life. For seniors, trust is closely tied to emotional safety. When you feel respected and unrushed, your body responds with cooperation rather than tension. Sleep improves, memory steadies, confidence returns. These are not small outcomes. They are signs that care is working as it should. I want to acknowledge that medical systems can feel intimidating at times. Forms, appointments, and unfamiliar language can create distance. But behind those systems are people who are trained to care, to listen, and to protect. Most medical decisions are made with restraint and responsibility, guided by experience rather than fear. Preparing emotionally for closure means allowing yourself to feel settled with what you know. It means recognizing that understanding does not require constant vigilance. You are allowed to trust the process. You are allowed to return to your routines and let this information take its proper place in the background of your life. For caregivers, this trust offers relief as well. When systems are understood, the burden of worry lightens. Care becomes shared rather than carried alone. Calm spreads through households when reassurance is genuine. As a physician, I believe that the best care leaves people feeling steadier than when they arrived. That is the goal of diagnosis and of every conversation we have shared here. Knowledge is meant to support peace, not replace it. As we prepare to move toward closing, hold on to this sense of quiet confidence. You are supported by systems designed to care carefully and thoughtfully. You do not need to rush. You do not need to fear. You are allowed to rest in understanding, knowing that you are not facing health questions alone. Thank you for staying with me and for listening all the way through. That quiet choice to remain present is not a small thing. It reflects care for your health and respect for your own understanding. I want you to know that I do not take that trust lightly. As we close, let us return to the heart of what we have shared together. Diagnosis is not a moment of alarm. It is a thoughtful and protective process designed to guide care with patience and clarity. Doctors move carefully because your body deserves time, attention, and respect. Most medical evaluations, especially for older adults, are measured and cautious by design. They are meant to support stability, not disrupt it. Over many years of caring for seniors, I have learned that patience is one of the most powerful forms of medicine. The body responds best when it is not rushed. Understanding grows when it is allowed to arrive gently. There is strength in trusting a process that unfolds step by step rather than all at once. I also want to honor caregivers and family members who walk beside older loved ones during medical visits. Your presence matters more than you may realize. A familiar voice, a steady hand, and shared calm can change the entire experience. You help create safety in moments that might otherwise feel uncertain. As you move on with your day, I hope this conversation leaves you feeling steadier than when you arrived. Knowledge should feel like reassurance, not pressure. It should give you confidence to return to your routines with ease and trust. Senior Health Daily was created to be a place you can come back to whenever health information feels loud or overwhelming elsewhere. A place where explanations are gentle and dignity is always honored. If this space has felt supportive to you, I invite you to stay connected with us. Take care of yourself with patience and kindness. Your body has carried you a long way, and it deserves gratitude. Until we meet again, know that you are not alone in your journey toward understanding and well-being.